Hi, my name is Tammy Johnson. I'm the Hospital Director of Admissions for Rasmussen Region Hospital. Today we'll be discussing Kansas versus Colorado Medicaid. Kansas didn't expand its Medicaid due to the budget of the ACA analysis that stated there would be an increase in its enrollment. The increase would cause the budget to go to $1.2 billion, and with Kansas already having a deficit in their budget as it is, they did not want to do that. The issues with filing all the claims: there is already struggles processing claims and would take even longer the more people there were. And with HMO plans, they are not popular in our state. None of our providers in the state of Kansas or our patients like HMOs. Colorado, on the other hand, expanded its Medicaid program, and it has brought revenue to the state. It has brought $3.8 billion in revenue, and it created jobs of over 31,000 in new jobs. It helps the vulnerable by everyone being able to pay. There were 45% of people that qualify for Medicaid, and 22% qualify for subsidies for private insurance. It also helps the nursing homes expand due to easy access to coverage. There is little to no restrictions to getting Medicaid. If you are under the income guidelines, they get it whether they are a man or woman. Colorado dropped its underinsured rate from 14.3% to 6.7%. Regulations for both states. These rules apply for both and receive Medicaid benefits. Licensing procedures for the following: administration and ownership, classification, allocation of beds, special care services, patient statistics, surgical facilities, services and procedures, outpatient and emergency room services, and staff personnel. For accreditations, for being up to date on those, all hospitals have to have JCAHO, and it's a must. They are with Medicare and Medicaid, and if you are not accredited, you do not get paid by Medicare or Medicaid. You must meet EMTALA guidelines. EMTALA means any emergency services, regardless of the ability to pay, must be treated. Statewide repository of health insurance claims from all healthcare payers, including insurers, government programs, and self-insured employer plans. In Colorado, this is a must due to targeting for cost containment and evidence of effects on cost. The differences in the states is that Colorado is mandated to do the transparency and disclosure of healthcare cost. This requires hospitals and other licensed or certified health facilities to disclose the average facility charge for treatments that is a frequently performed inpatient procedure prior to admission for such procedures. Colorado's essential health benefit benchmark plans are more than what Kansas requires. Both states cover vaccinations, early detection services, maternity and baby coverage, and mental health, but Colorado has to cover congenital defects, hearing aids, prosthetic devices, cleft lip and palate, and contraceptives, and many more. Colorado is based on the Kaiser Foundation health plan that has HMO plans, and as we discussed before, HMO can only go to certain doctors. The patients can only go to certain doctors. Kansas has Blue Cross Blue Shield of Kansas, and they are PPO plans, and PPO plans are more flexible about what doctors you can see and treatments you get. The ethical issues for both states. In Kansas, not being able to care for the low-income families Unless they are pregnant and disabled or have minor children and under the income guidelines, you don't get Medicaid. Men rarely get coverage. Fighting chronic illness for the poor. Can't afford private insurance due to no help with premiums for ACA due to no expansion of Medicaid. The long wait times for people who do qualify for Medicaid. The wait times are 3 to 4 months to process applications for Medicaid, and even babies are taking a month to 2 sometimes to be approved, which is substantially long wait time right now. The long wait times are also affecting the nursing home placements. Nursing home placements are not wanting to take people who are Medicaid pending because they are not. It takes so long for them to be approved that sometimes people are denied, and then the nursing homes lose out on so much of that money. Long time wait times for treatments and medications. Some treatment for cancers are very expensive and can't afford the treatment or medication, so puts patients more at risk. The Colorado ethical issues are processing claims for the providers. The providers in Colorado are getting upset because it is taking too long to process claims so they can get paid. The limitations on what doctor people can see. On a person can see for a doctor might lead to a misdiagnosis, suffering, or wrong treatment. Qualifications for Medicaid interfere with people getting private insurance. Some people want private insurance but qualify for Medicaid, so it kicks them out from getting their own insurance, and then they have to file appeals, which could take months. Quality of care. With so many patients on Medicaid, keeping up with the quality of care for doctors and hospitals would be hard to do and to be efficient. Recommendations. As the hospital director of Rasmussen Regional Hospital, my recommendation is to stay in the state of Kansas and build a non-for-profit hospital. My reasonings are, it feels it is more beneficial to serve the people in Kansas by having a non-for-profit hospital here to give care to the vulnerable and undocumented people of Kansas. To build a non-for-profit, to take our profit, we would make and benefit the community of the homeless, mentally ill, alcohol, and drug addiction centers. Provide specialty services with qualified doctors, and giving people a choice on doctors that they feel comfortable with. Help people whether they have the ability to pay or not. Still providing specialty services with a great cancer treatment center, rehabilitation center, and joint and spine centers to get people healthy again, to have a quality of life. Thank you. This is Tammy signing off.